Hi and welcome to Home Care This Week. Among the many things that are confusing about health and health care is going to be medications. And one of those areas that it gets even just as confusing as the others is in treatment of depression. And maybe a lot of people don't realize, but in the senior population, depression is a huge problem. It is just as big, if not bigger, than in other populations. And medications can be just as confusing in that environment as any other. I had a chance to talk with Dr. Paula Bailey Walton at the Heritage Sierra Medical Group. And we talked a little bit about depression, we talked about a lot of the elements of it, and one of those things was medication. So that there is at least some understanding of those medications, what they are and how they work, so that people who are dealing with this disease of depression or have a loved one, and in particular seniors, can have a little bit better understanding of that. And here's a little bit of what we had talked about.
What the medications are doing is returning some level of
normalcy to
functioning.
Right, exactly. So they're fixing a problem that's present. And usually serotonin is the receptor, is the neurotransmitter that is most deficient. But dopamine, which is linked to the pleasure and reward center in the brain, can also be deficient. And that is responsible for some of the brightness that people have, the energy, the verve. That joy of life that people have, that is considered to be part of the dopamine's activity. Okay. And so the dopamine reuptake inhibitor, Wellbutrin, can be helpful in that.
And it works similarly.
It works similarly, and it works in conjunction with the serotonin reuptake inhibitors like Lexapro, Celexa, Prozac, Paxil, Cymbalta. Well, not Cymbalta. Cymbalta is a different one. I say that serotonin reuptake inhibitors are the cake, and then the dopamine agonists are the frosting. So,
Interesting.
So sometimes the doctor will recommend a combination of medication, and it's for that reason.
Okay.